Are you ready? All right. Good morning, everybody. I think I know everybody here, but just in case you don't know me, I am Judy Cooper. I'm the Executive Director at the Orange County Chamber of Commerce. And we are here this morning at Living Water Community Clinic, which is a hidden little gym here in Locust Grove. And without any further discussion, I'm going to turn it over here to Debbie Martin, who's the operations manager, and let her tell you a little bit about what goes on here.
I know many of you may have been expecting Debbie McInnes to be here, another Debbie. She's our executive director and she tested positive for COVID this morning. So she really regrets not being here. We've been planning this since what, I don't know, March? Yeah. And so, I mean, she's really disappointed that she wasn't able to be here with you. So you're stuck with me. I'm one of the now 7 Debbies we have out of our 78 volunteers. There are 4 on the leadership team of 7 people.
Wow.
And we have 2 in the dental program, 1 new, and 2, I guess, on the, 1 on the medical side to volunteer. So just a little bit about the clinic. Before I do that though, I do want to introduce some of our representatives who are here today to be with you. This is Bud Moody. He is a member of our board of directors. Dr. John Sellers, he is our dentist in charge. And John Gingrich, who is also a member of our board. And right there is Marianne Brancato. She's our patient care coordinator, which is like a head nurse or a lead nurse. So she's very busy. She's here for almost every clinic. She was sharing her job with someone, and that is on pause for right now. So a little bit about the clinic. We were started in 2016 as a vision of the now senior pastor at Lake of the Woods Church, Adam Colson. And this was a vision he'd had for quite a long time. It was kind of a dream come true type thing for him. We started in 2016 and had patients almost immediately. The ribbon cutting was on May 28th, 2016, so that's what we celebrate, and we had an open house here a few weeks ago to celebrate that. We take care of, to be eligible for the clinic, our patients have to live in Spotsylvania, Orange, or Culpeper counties. They have to make less than 300% of the federal poverty level, which I'll give you an example of that. The federal poverty level for a single individual, and it graduates by number of dependents, is $15,060 for 2024. So a single person could make up to $45,000 and still be a patient here. And the real qualifier is that you have no insurance. Now, we do see patients with Medicaid. We do not bill Medicaid, but we can see them because we are primary care, and they sometimes have issues with getting care from a primary care in any type of timely fashion. And I can work, I take almost all the calls here since I have a phone I carry with me everywhere that the front desk phone is transferred to. We can get somebody in usually within a week or 10 days pretty easily. We started with clinics on Thursday nights, and we do have every Thursday night we have a clinic except the second week of the month, which then we have a Saturday clinic. Now in 2021 we opened the dental clinic, and if any of you knew us before, we were in the front side of the shopping center when we first opened. We moved back here so we could rent another suite so we could have our dental clinic open. The dental clinic usually meets with us on that Saturday. And this past Saturday was the second Saturday of the month, and we had initially 7 patients that were going to be on the medical side, and it ended up being 4, which is not unlikely, but they had 9 patients over in the dental clinic. And they're going to be having another dental clinic on Monday, the 17th. We we're able to expand the beginning of this year, our time availability. So we have a medical provider who's willing to work here every Monday morning. And so he is here. So now we have our clinic open Mondays and Thursdays, except the second week, and then it's Mondays and Saturdays. The dental clinic has been lucky enough to have a visiting dentist that was coming in on some Thursday nights, one Thursday night a month. Right now that's not happening, but they are arranging to have staff come in another day a month so that they have 2 opportunities for patients to be seen. And I have to tell you, a lot of the people that call me are interested in dental. You know, even Medicare aged people who have Medicare A and B but don't have a supplement, we can see them over there. Otherwise, Medicare A and B would disqualify somebody. Like, we couldn't see them on the medical side. We could see them if they only have A, which is the hospital. But, you know, I have to take pictures of that. And we have, our eligibility process is a little cumbersome. There's actually 15 pages they fill out, but not everybody fills out all 15. And some of it is a little redundant information, and some of it we have to collect for the state. We do look at eligibility once a year on people to see if their salaries have changed, if their insurance, and of course they're told that they need to let us know when they have insurance. Because a lot of people come here when they're between jobs, and Cobra is way too expensive if any of you have ever had that opportunity. So that is pretty much the background. We are funded totally by donations. We do get a few grants from the state, and we do apply for grants from, the Lions has been very generous to us. And so right now we're able to give out blood pressure cuffs to anybody we see for hypertension that doesn't have one because of a donor through the Lions. The main reasons we see people are hypertension and diabetes. Those are probably the main 2 things we see people for, and depression, joint pain. Those are probably the things that we see people for the most, but not the only things, of course, but we are primary care. So we do take people with Medicaid, which makes it easy for them if we refer them on to a specialist. We work with Mary Washington and UVA in qualifying people for their financial assistance. Now, of course, this is kind of between the patient and them, but we do get it initiated, so we try to help them get together what they need. And many of our patients find it too cumbersome. Some of our patients that are not working and make less than 138% of the federal poverty level are eligible for Medicaid. We have to get a denial for Medicaid before we can proceed with any kind of financial assistance help. So we do encourage our people to do that, and they don't for a lot of reasons. I mean, we can continue to see them, but if they need x-rays, or we do lab work for them that's of no charge. Nothing here costs the patient. In most cases, we pay for all the prescriptions through a program at Moss Clinic, and we do have an arrangement with a private vendor that we can use through CVS. And there are some that we do pay cash for outright, but not many, because you can imagine if we only work on donations, we don't have a pot of money to pull from. And that's why we try to get the financial assistance for our patients to have these specialist appointments. So, I mean, with Mary Washington, you can make up to 500% of the national poverty level and still qualify for assistance up to 70%. Now that's 70% of the whole bill. If you're hospitalized, it's incredibly expensive. So it can be a lot of money. So that's a little bit about the clinic. Do you all have any questions?
Debbie, is there a targeted age group that you all have? that
Eight-
you-
18 to 65.
Okay, so you're not pediatrics, not, okay.
On exception, we may see, you know, on a case-by-case basis, we could possibly see someone in pediatrics, but we do not accept, and I have a lot of people call me for that. But of course, they should be eligible, if they have no insurance, they should be eligible for WIC. So, you know, there is places they can go. We're not turning them down for care.
A lot of doctors may not be certified to take care of pediatrics. Like if you have a family
Sure.
medicine doctor, they could, but if you have a straight adult medicine doctor or like a cardiologist, they're not gonna feel comfortable with that.
Right, right, that was the point of the question, it was,
Yeah.
you know.
Yeah.
Our medical director is a cardiologist, so
Yeah.
you see that we don't schedule any well woman checks with him, but we do with our other primary care physicians.
Okay, I wanna talk about this thing over here,
Okay,
and if you all didn't see these,
we received a donation of 160 quilts that were handmade by our pastor's aunt. And these are available, oh, I'm so
Sorry,
sorry. These are available for the patients to pick up as they come in, so we just replenish the bucket.
they're just beautiful.
Thanks.
And I really appreciated the handiwork on those.
Well, and you know, you see the advertisement that for every pair of Bombas socks that you buy, you get they donate a free one. Well, I'm testimony to that. Culpeper Clinic actually is the one that shared the socks with us. They got 7,000.
Wow.
And we probably took about 700 actually. And then one of our volunteers, one of our security volunteers, was something through his daughter. Anyway, he brought me another 200. So we will have, but the ones he sent us are the half socks. So, you know, it's summertime, the others are warm, so, you know, we have both. Let me talk a little bit about the volunteers. We accept volunteers for any of our positions. We have applications that I send to them. We have a volunteer coordinator. She is one of the other Debbies. Her name is Debbie Harris. And we primarily use volunteers in nursing, front desk, security. We need them, and medical providers, of course. We need them every clinic. We have chaplains that are provided by the church because we do provide spiritual counseling as well. And so there's somebody here from the church at every one of our clinics. So those are primarily, but like my position was kind of created because I made an application. Okay, Debbie needed help. My background was mostly in administration, in HR, and in fact, I just retired when we moved here in 2021, when I turned 70. So this position was created as I applied. So, and I've been here since February of 22. And she probably needs more help again, because I work about 20 hours, I volunteer about 20 hours a week. And Debbie works a lot of hours from home. We do keep track of the hours because that's how we are granted some grants. That information is important for that. So was I gonna throw that on the floor?
Getting ready.
Thank you. So we'll take applications if any of you have anybody that you know that would be interested. We only require that our volunteers work one shift a month, 4 hours usually. And that's why Marianne and Debbie McKinnon are here for every clinic, because we've got to have that continuity with the patients. The provider changes every clinic. So, you know, and we have medical records, hard copy. We do not have electronic yet. We've talked about it, I guess, probably since I've been here. But a lot of the providers don't want to learn another kind of system. And I think we found something easy enough that you know, they may be giving into this, and it's probably reasonable enough that we could afford it. So, that's in the works. But we, and as far as our patients are concerned, I have brochures right here that I would encourage you to take with you. I know we're going to kind of hopefully partner with them to get some of their behavioral health people, so, that don't have insurance. But that's the primary thing, if they don't have insurance.
Now, if somebody's interested in volunteering or in donating, you have a website?
Mhm. We've just updated our website
Awesome.
as of this past spring. And I think it's easier to move around in now. It's a little more user-friendly. Our two main fundraisers per year is a golf tournament in April or May, and then our gala, which is usually in November, right before Thanksgiving. And then we do things like any other charitable organization. We send out what we call give letters, at least once a year. To advertise for patients, we've done a postcard mail out. And what we did initially is send it, we can get a report through the county that will tell us who lives within a 5-mile radius of the clinic and who makes, let's say, less than 50,000. I'm not sure exactly what her criteria was. And postcards go out to all of them. This is costly, but it does bring us patients. And maybe it doesn't bring us the patient that received the card, but it brings us their son or daughter who just lost a job. Or their mother who's not old enough for Medicare, but is no longer working, something like that. So, there's a lot of opportunities for receiving patients. All they need to do is call the clinic. And I do a little pre-eligibility screening with them over the phone, and then we get into the paperwork. And even for the dental clinic, even though we have people like Medicare A and B recipients that can be seen in the dental clinic, but we can't see them on the medical side, everybody is qualified through the medical clinic, because you have to be eligible to see us to be able to be seen over there, other than the Medicare A and B.
Okay. All right, well, thank you very much.
You're welcome.
That was very appreciated. Does anybody, look at everybody's attention.